In this chapter, we're going to take a look at microbes and the role that they're going to play in pathogenicity. And I just pulled up some cartoons just to sort of start you off on the right foot, because the stuff that we're looking at here can get a little bit freaky and a little bit depressing, but it is kind of funny to think about over here. If you went to the doctor and what you would think if the doctor said, don't panic, but please take off all your clothes so that we can burn them. And this idea of pathogenicity really goes back to the 1880s, where people were looking at the microbes that are out there that were identified to cause diseases. And we'll take a little bit of a look at that with Kochs postulates. But if we take a look at that root of the word here, this idea of pathogen, this comes from the Greek, that pathos is really refers to something that produces suffering. And if you think about pathogens or microbes that are causing diseases, well, that right there is going to cause some suffering or some emotions that you're going to feel there when you are getting diseased, because you're seeing really a change in the normal structure or the functions that are going on inside of your body that are being damaged as a result of the presence of the pathogen that's causing this disease. And so we'll take a little bit more of a look at this process here, and also spend some time looking at really this difference between colonization versus infection, and what's going on with the invasion and how this is going to cause damage to you. And so if we go back and sort of look at this idea of diseases that are causing damage to you, the damage that we're going to see coming out is sort of summarized in this table here, because diseases are going to produce some common signs and symptoms. And when we look at this idea of the signs over here, you can see a variety of different medical terminology associated with this stuff. But the distinct difference between signs and symptoms over here, other than the way they're spelled, is the signs are things that we can actually observe and measure. So you can definitely measure something like a fever. You can measure the presence of a bacteria in your blood or in your tissue fluids that are out there. When you look at the symptoms over here, this is distinctly different, because this is a lot more subjective. The symptoms are what the patients are going to feel. And this is something that is a little bit harder to measure. Something like a fever, yeah, that's easy to measure. You check somebody's temperature. But if somebody says they're experiencing chills, how do you measure something like that? How do you measure something like headache or itching that is out there? But definitely when you look at these signs that are out there, these can be experienced by the patient. And when you put together the symptoms, so a patient comes into the doctor and they say, what's going on with you? You report your symptoms, but at the same time, they are also going to be checking your vital signs, because those are really a measure of what's going on with the basic functions of your body, and any changes that go on in the signs that are experienced by the patient and that are measured by the healthcare professional. Now you might have something that could help to diagnose what's going on with that patient. So when you go in and they check your vital signs, think about it. They're going to check your body temperature. They're going to check your heart rate to make sure that you actually have a pulse. They will check your blood pressure, and they will check your breathing to make sure that you're falling within what's considered a normal range of these different kinds of things for your vital signs. And when we put the signs and the symptoms together, you can sort of use this to come up with an idea about what's going on, and that's where we can start to group these together and come up with what's known as a syndrome. And that's where you take your signs and your symptoms, and those are going to be used to diagnose a different, specific kind of disease that's out there. So really good example is when you hear about AIDS, acquired immunodeficiency syndrome. When you're looking at it for viral syndromes that are out there that are causing AIDS, there are going to be specific kinds of key factors that they can measure there. So they will look whether or not you have secondary infections. They will look at the number of T cells in your body, and they will look at the number of viral particles or virions in your body. And so those three different kinds of things that can be measured along with the symptoms are going to be used to help with the diagnosis of that particular type of syndrome that's out there. And when we look at this stuff, you can see there are a lot of specific kinds of words that are used to describe these symptoms for infectious diseases. And so you can see a variety of them right here. Probably the one that we are most familiar with and thinking about is this itis right here. And itis, whenever you see that tagged on to anything else, is just inflammation. So you can have arthritis and inflammation of the joints that are out there. So just think about these terms and how they can be used. Whenever you hear about derma, you're looking at something associated with the skin that's out there. So just a variety of terms to be familiar with that a lot of us have already been exposed to, whether we've taken anatomy and physiology or if we're in micro and getting exposed to some of the stuff. We've certainly been exposed to these kinds of terms throughout our lifetime there. But we do want to continue on and take a look some more at the diseases that are out there. And if you look at this little one, it's kind of a funny little one to think about. But when we consider this idea of diseases, we can put them into a variety of different kinds of classes. Infectious diseases, those are ones that obviously are going to be caused by a pathogen. Again, something that generates emotion or pathos in you. And then infectious disease is caused by something that can be a pathogenic nature that's out there. If we have a communicable disease, that's one that's going to be spread from person to person. If you have a contagious disease, as we're all familiar with now after the COVID-19 scare that's going on, that is definitely something that is easily spread from person to person. We look at the flu virus as easily spread, but the COVID-19 has some characteristics that make it even more likely to be spread. So it's extremely contagious. Likewise, you can also have iatrogenic diseases that are going to be contracted as a result of some sort of medical procedure. So think about a surgical site that has become contaminated by microbes that were floating around in the surgical suite. That one might be contagious, but it could also be classified, and these are certainly done to distinguish different kinds of microbes and where they're appearing in hospitals. And you can see this little guy right here is another example of a disease that could be spread out there. And here you could be looking at something like a swine flu, where we have this little kid who is the one who is picking it up by going out there and kissing the pigs that are out there. And this is one that we would classify as a zoonotic disease that's being transmitted from animals to humans. And so, our example there with COVID-19 or something like rabies or malaria that's being transmitted via mosquito bites that are out there. Likewise, we can also find that there are certain hospital-acquired infections that are out there. You think about going to a hospital, there's going to be a bunch of sick people there. They can be coughing and spreading these things around, so now you're going to get transmission through fomites. They're coughing on the nurses and the doctors and the other hospital staff, and so you can get this nosocomial infection that's being acquired by being in that hospital setting. And these are extremely worrisome because you're also looking at antibiotic resistance developing in these things because they're being treated, and that could make them even more pathogenic and cause even, or more likely to cause diseases out there. All right, so when we take a look at this process here, we've got all these different kinds of classifications for disease, but we can also look at the progression of the disease. And this little graph shows you really two key points here. You're looking at, in red here, the number of pathogen particles. So think bacteria numbers or viral load that's out there. And over here, you're looking at the severity of the symptoms in the blue color right here. And so remember our distinctive difference between signs and symptoms. Signs we can measure, and these are symptoms. So these symptoms are telling you something about how the patients are feeling. And we can see that right in the middle of this graph right here, the patient is experiencing the most symptoms here. And this time here can vary depending on what kind of pathogen you're looking at. But the important thing to note here is if you're looking at an infectious disease, that patient could be contagious anywhere within here. And what we do know now about this COVID-19 scare is it looks like during this period of convalescence, this can extend out for 40 days, that you can still have viral load, and these patients are testing positive for that. So they might have gotten rid of the signs and the symptoms, but they are still contagious here. And so if we go through some of these different stages here at the beginning of this process here of the infectious disease that's occurring, you have what's known as the incubation period. And this is when you have the initial entry of that pathogen into the host there, and it's going to start multiplying there. And at the beginning, it's multiplying, but you might not start to feel any real good signs or symptoms of the disease there. If it's an acute disease, you could be looking at this whole process here going on in a day or two. If you're looking at something that is a chronic disease, now you're talking about months or years. So this time frame can really vary quite extensively across the span of days to years. After you go through that initial incubation period, we can see during the second prodromal period, this is really when the pathogen has gained a foothold and it's starting to multiply. And during this process, you're going to start to cause damage to the host, but also the host immune system is going to start reacting. And that's why you're going to start to experience things like signs and symptoms. So if we think about flu virus, you're going to start to experience a fever. You're going to start to experience muscle aches that are associated with your immune system response to that. And so we can continue on, and you can see that we're getting this increase in the number of particles, but also an increase in the symptoms that the patient is experiencing there. And we go into this period of illness, and this is where you have the most obvious signs and symptoms going on in the patient, and they're going to be the most severe. And so if you, again, look at the flu virus, it's going to be that acute thing. So it's going to be taking place over a time span of days. If you're looking at chronic things like ulcers or hepatitis B, now you're looking at months to years here, because this period of illness is going to extend out because it's really hard to clear those pathogenic particles there. You can also have this period of illness go into the latent phase. If you think about chicken pox that is out there, you get rid of that and you go through the rest of this, but you're still going to have some of those pathogenic particles hanging out in your nervous system, in your dorsal root ganglia when we're looking at chicken pox. Or if you look at a disease like mononucleosis, they're going to actually hang out inside of lymphocytes in your bloodstream. And those guys can come back and start that process all over again when we're looking at this. Once you go through this period of illness, if you're fortunate, your immune system is going to have developed the ability to recognize the pathogen that is there. And the primary role of the immune system is to confine the spread of that pathogen, but also reduce or eliminate that pathogen if possible. And that's where we go through this period of decline here, as the number of particles goes away. And you can see it's a nice little sort of linear drop in the number of particles there as your immune system clears those. You're going to start to see the decrease in the signs and the symptoms. So what's going on in the patient is going away. The problem with this is where we are at most danger of secondary infections developing, because your body is really focusing on that particular pathogen there. And so really you are a little bit weakened with your immune system as you focus on that sort of thing. And you can sort of use the analogy of driving in your car with your cell phone on. You change your focus to your cell phone as you're trying to text somebody, and that's where you get into some accidents. So there's your secondary infection. And then at the end of this process, if you've survived up until this point, you go into your period of convalescent, and hopefully you return to normal with some damage that might have occurred either as a result of the pathogen itself or your immune system causing some damage, as you possibly had an inappropriate response going on to the pathogen that was there. In order to look at all of this stuff, and in order to identify these pathogen particles, you need to have some method of identifying which particular pathogen is causing a disease. And that's where, if we go back to the 1880s, we can find some research that took place in the laboratory of Koch in Pennsylvania, and he was the one who came up with a set of postulates, or really a framework with steps that can be used to confirm a specific microbe is the cause of a specific kind of disease. And when you go through this process here, you can take a healthy host that's out there and say streak out some blood or do something to look for a particular kind of agent. And if you're healthy, it might be absent there. But if we look at the diseased organism, you take a look under the microscope, you see some stuff in the blood that is not there in the healthy host. So you've got an indication that maybe you're looking for something in the blood. So you go ahead and you try and isolate that. And so you go through this process here to grow it in the pure culture. And then you take that and you inoculate it or inject it into a healthy host, and you go through this process here and you show that the healthy host is going to experience the same kind of disease that we would see in the ones that are out there. So you're basically saying, hey, this particular agent that we isolated here is causing the same signs and symptoms that we found there. But then they took it one step further here and were able to show that it might have been absent in the beginning in the healthy host, but now when we look at that diseased host, we can see that not only did it, in fact, it was able to maintain some presence inside of that healthy host. So you have to re-isolate it and show that what we got here is the same as what we got from that diseased organism over there. And there are certain kinds of problems that are associated with Kochs postulates here. And if you think about it, there are certain kinds of organisms that we can find in healthy hosts and diseased hosts, but you don't necessarily have to be feeling that disease. And one really good example of this is a bacteria known as Haemophilus influenza, that they identified in patients who had influenza. And so they found this bacteria there, but the bacteria wasn't actually causing influenza because that's a viral infection. So they weren't able to isolate the virus because they didn't have the right culture conditions. So just because you find something in diseased organisms that are out there does not necessarily mean that it's actually the cause of that. So we run into this problem that not all people or not all animals are equal in terms of their susceptibility to these diseases. You can have people that are carriers of different kinds of bacteria or other pathogens, and they're asymptomatic. They don't know that they're actually carrying that and potentially transmitting it. The other thing to think about is, again, that idea of influenza virus. You can't always culture this stuff. And with Legionnaire's disease, this happened in 1976. A bunch of World War I vets got together in a hotel in Philadelphia, and the air conditioning in July was on maximum, and it was spraying this bacteria onto these older war vets, and they developed a respiratory infection. Well, that particular bacteria they were not able to culture, and it took them probably another 20 years before somebody finally figured out that they had to add activated charcoal to the culture media in order to allow this particular microbe to grow. So that one would not have gone through Koch's postulates because they were never actually able to get it isolated and grown in periculture there. And then sort of the last thing to think about is this idea of this little guy here. What do you choose as a host? If you look at HIV, it does not cause infections in mice. It only causes infections in humans. So now you need to find a human host to use for your HIV test to prove that. And when we look at this process here, viral AIDS has never really been truly confirmed with Koch's postulates. But we do have this sort of corollary of doing this molecular Koch's postulates where you can take certain kinds of molecules out of cells and take a look at them. And sort of related to this idea of Koch's postulates is we want to be able to measure the number of these infectious particles and figure out how much do you actually have to be exposed to cause these kinds of diseases. And that's where we can take a look at this idea of measuring pathogenicity. So when we look at this term, there is pathogen is something that generates that suffering in you, and when we throw this together here is we're really looking at the ability of the microbe to actually cause a disease. And this idea over here, virulence, this is really measuring the degree to which that organism is likely to cause a disease. So it could be avirulent, it is not likely to cause a disease, or highly virulent. When we look at something like COVID-19 out there, it seems like it's a very highly virulent kind of virus there. And in order to do this, we are going to use some controlled experiments with some lab animals that are out there. And we can measure two really important kind of characteristics of these different kinds of germs or pathogens that are out there. And one of them is known as the median infectious dose, or it's often written as ID50. And that gives you some idea on what they're doing. Is they're basically causing these infections in these different kinds of animals there, but they are measuring the number of particles that are causing an infection in 50% of your group that is out there. So we don't, again, use this. We're looking for 100% because there is going to be some variation in different animals' response to the pathogen that's out there. If you took a group of people that are out there, you could look at a median infectious dose, probably not with a BSL 3 or 4 organism unless you want to have an outbreak there, but you could certainly do an exposure to some less virulent kinds of things to get an idea on what's going on there. The median lethal dose, this is probably not something that you could get medical permission to do a study on, because here you are looking at the dose that could result in the death of 50% of your population out there. So oftentimes these will be done with a variety of lab animals, but again, you run into that problem with Kochs postulates that's related to not all kinds of pathogens that infect humans are going to infect other kinds of animals. And if we look at this figure from the book, we can see when we're measuring this virulence and the median infectious dose for different kinds of foodborne diseases. The viruses tend to be a little bit lower in terms of the numbers, but you can certainly see that if you look at this one right here, you could have an infection going on just due to the presence of a single kind of bacteria or a single kind of protozoan cell that's out there. So a lot of variation, but it gives you some idea that we do get different numbers of things that are out there. If you look at Vibrio, these are ones that are being transmitted via the fecal-oral route. So you're going to find a lot of these bacteria floating around in the water for people to consume. If we look at looking at that virulence and the ability of these things to kill, you can see right here, if we look at enterotoxins, so entero, think intestines, this would come from a staph that was maybe on somebody's skin getting on a food, and then you consume that food that's been sitting out after the staph has been making this toxin. If you look at it, it takes a pretty good amount of this to be lethal to mice, so we can measure really the mass of that chemical versus the mass of the animal there. And we could sort of extrapolate this and figure out, okay, if we know how much the weight of the mice is, we can take the weight of a human and figure out the dose of that. Shigella toxin, this is the cause of traveler's diarrhea, so it either kills you or makes you wish you were dead there. But if we look at botulinum toxin, you can see this is extremely toxic kind of thing. And if you think back to when you were making media, we were doing milligrams was you're talking about a few pinches of salt here. Well, now we've gone past microgram and we're into a nanogram. So you're talking about a massive change here and a very, very small amount. We're talking a fraction of a crystal of Botox here could be enough to kill a mouse here. And you could literally take a bag of Botox and dump it into a water supply and kill off everybody in a city there. So we know that Botox is extremely potent kind of toxin that's out there. And in the next video, we're going to go ahead and start to take a look at this, which is really the stages of pathogenesis and what's going on as the pathogen is getting in and causing some damage to the host there, and see some of the different strategies or evolutionary changes that have taken place in the pathogens to allow them to cause these kinds of diseases.